Everyone, this is Diana Berrent. She is the founder of Survivor Corps. She is a COVID-19 survivor, one of the very first people in the United States to be diagnosed with COVID-19 in New York City. She's on the Upper West Side. And she has taken her experience and started her very own nonprofit. And what launched as what I remember as a private Facebook group has grown into this robust organization that's really helping move the needle in the world of finding a vaccine, finding ways to help with the long-term effects of COVID-19, which you're going to get into a little bit. But I'd love, Diana, if you could just introduce yourself to our Cause Marketing Summit attendees and let them know a little bit about your experience and Survivor Corps.
Absolutely. Thank you so much for having me here. This is amazing. And what an incredible group of people to be speaking with. So this is truly an honor. I was one of the first people in the New York area to get a positive diagnosis with COVID back in early March. And I was in isolation for 18 days in March with COVID. I never had to be hospitalized. I had what I call the Tylenol and Gatorade variety, the average kind that you get better from, or so you think. And I'll get into that in a moment. But while I was in isolation, I started to get solicitations from Mount Sinai looking for volunteers to donate their plasma, because the plasma is the yellowish, watery part of your blood, and that's where the antibodies live. So my body did exactly what it was supposed to. It encountered a novel virus. It built these antibodies, almost like an internal hazmat suit, which then allows you to share those antibodies by donating your plasma, which is easier than giving blood. And you can actually create an immune response in another human being, which is it's literally saving lives. So when I started getting the same solicitation from so many people, because I was the only person anybody knew who actually had COVID at that point and had gone public with it. And I realized that there was, they weren't going to be the only game in town for long, and there was going to be a free market that was created for plasma because there was going to be a huge demand for it. Convalescent plasma goes back to the 1890s during its use it was first developed for use against diphtheria, and the Nobel Prize was won for it in 1901. So it's been used, it was used during the Spanish flu, it was used during polio, it was used during Ebola, H1N1, SARS. So it has a very long history. And I realized that if I had the potential, if I was going to be one of the first people to get COVID, at that point, I was pretty sure I was going to come out of it okay because I was far enough into it, that if I came out of this, I remember just back to 10th grade biology enough to realize that I'd be coming out of this with antibodies that could save lives. And if that was the power that one person had, imagine if we could create a coalition of survivors. And so I started a group called Survivor Corps on CORPS. I named it after the Peace Corps. And I started on March 24th, and it grew exponentially, it grew like crazy. We are at well over 100,000 members right now. And we did so well with filling the pipeline of plasma to all of these research institutions that none of them ended up having to launch their own recruitment processes. None of them had to advertise because we did it all for them by creating a model of donation and raising donors up to the level of superhero, and making it a really empowering marker of, you are past this virus and now you have the ability to save lives, which is extraordinary. And it's an extraordinarily empowering message to give to somebody who's just suffered through something really quite frightening. And so by the end of April, Columbia University, where I was the first donor of convalescent plasma, I was participant number 0001. But by the end of April, we had, I think there was a 7,000 person waiting list. By May, there was a 3-month waiting list at the New York Blood Center to donate plasma. So we started partnering with the biotech companies who are creating plasma-based therapeutics, looking to create what's called a hyperimmune globulin product, which is just the fancy way of, I don't know if you have any cooking experience, but imagine taking gallons of plasma and almost making a sauce reduction from it. That could go in, that could possibly be administered as an intramuscular shot eventually, that it would, could really be the best stopgap effort until we have a globally accessible vaccine. So so we started partnering with private biotech companies, and that was really extraordinary. So we were already partnered with all the blood banks. We started partnering with the fractionators. And then we started to realize that a lot of our members were not getting better. Because I started Survivor Course so early on in the pandemic, we have captured the real life experiences of, 100,000 people going back, they have recorded their experiences in real time. And we realized how valuable that data was because, if you think about it, as a country, we are tracking infections, we are tracking hospitalization, and we are tracking mortality. And all of our medical data is based off of hospitalized patients. That's only a small percentage of people who get COVID. The vast majority are left to quote unquote recover at home with Tylenol and Gatorade like I did. And none of them are going to the doctor. So nobody goes to their general practitioner because they have COVID. So we have this absolute dearth of information on this vast population. Almost all of the data that is coming out of all the medical data, all the scientific research is all being done on hospitalized patients because the rest of us never went to the doctor with COVID. We weren't under any medical care. Nobody goes to their general practitioner with COVID. And it's the first time in our collective experiences where we're being told, yes, you are very ill. You are really sick with something that we don't even really understand, but whatever you do, do not go to the doctor unless you literally think that you're dying. If you can't breathe, go to the emergency room, but anything short of that, best of luck. Wow. And so we realized that we had no data on this vast majority of people who have had COVID. And so Survivor Corps has been in many ways the canary in the COVID coal mine from the beginning. Because we've been tracking people in real time since March 24th, we saw COVID toes a month before they hit the media. We have seen, when the CDC expanded their list of symptoms from 4 to 12, we listed 98. We teamed up with Indiana University School of Medicine and just closed out a study of over 4,000 people, non-hospitalized COVID patients, which will be groundbreaking. It will be the largest study done to date. And it is patient-led research that really matches up to our core beliefs, which are, efficiency, working together, collaboration, transparency, and equity. And so we have teamed up with universities. We started a program with Columbia, a longitudinal study called Recovery Core, which will track people over the course of years, both serologically, so according to their antibodies, and symptomatically, so tracking their symptoms as well. And with that, we matched our cohort for Recovery Core in New York to the demographics of New York City and how it was impacted by the virus. So if 5 times the number of people who lived in the Bronx were infected than in Manhattan, then our cohort will reflect that. And one of the things that we started to see that was really startling towards the end of April was that many of our members were not recovering. And it's one thing when you see a story once and then you start to see it 10 times, but when you start to see it 100 times, you realize that you're looking at a real trend. And so there's now, thankfully, the world is paying some attention to this idea of long COVID or COVID long haulers.
Mhm.
But Survivor Corps, we had our first national media piece on NBC Nightly News on it back on May 17th. So that gives you a sense of how long we have been shouting from the rooftops on this issue. And what's happening is that 1/3 of people who get COVID are not recovering in time. And that's according to the CDC, who, I think that we can all say is admittedly conservative in its numbers. But even if we take them, at face value, we are upwards of 6 million infections right now. And that's not even including the college campuses that have not been worked into those infection numbers. And 1/3 are not recovering. 1 out of 5 are young, healthy people with no pre-existing conditions. Now, let me add that when I say young, that's 20 to 34. I'm 46. I'm not part of the 1 in 5. I'm part of the 1 in 3. So you don't need to be an epidemiologist to do the math and realize that we are at over 2 million people who could be potentially suffering from the really catastrophic effects of COVID. So one of the many things that we have learned a lot since March. Unfortunately, our policies and guidance has not followed as quickly as the science has. But one thing that we have learned is that this is a vascular disease. It is not a respiratory disease as we initially thought. And it does not, certainly we know for sure that it does not only affect the elderly and the immunocompromised anymore. In fact, the typical long hauler is a 44-year-old woman.
Wow.
So more men might end up on ventilators, but it is women who are experiencing this sequelae, this after effect, these, ongoing symptoms. And when I'm talking about these are not mild things. So I consider myself extraordinarily lucky. And I was just diagnosed with post-COVID onset glaucoma 2 weeks ago. And I still consider myself on the very lucky side of things. I do have some ongoing GI issues that come and go, headaches, deep inner ear pain. I'm going to a cardiologist this afternoon to get my heart checked out to make sure that there was no scarring or any other impact from the virus. But I'm extraordinarily lucky because I have access to Mount Sinai's post-COVID care center. There's a waiting list a year long right now, and there's really no other center out there like it. We will need post-COVID care centers around the country. The things that people are experiencing post-COVID are as dramatic as COVID onset diabetes, COVID onset lupus, tachycardia, myocarditis, kidney issues, which I mentioned, severe neurological issues, hearing loss. It is impacting every single organ system, and that goes beyond the obvious pulmonary issues that you would expect. So it is something that is so insidious. I mean, we have 25-year-olds in our group who are marathon runners who are on month 6, and they have on, 150 some odd days of having a fever, or 150 days of not being able to catch their breath. Or we have people, in the prime of their lives who are writers and editors who are having issues with aphasia. They are having issues with word retrieval. How are they going to go back to work? And what happens if they, need to go out on disability, but they were never able to secure a COVID diagnostic test back in March or April because either they weren't available or they were faulty.
Sure.
It is a huge, huge issue that really lays out a blueprint for what public health care could look like over the next decade or more. And that's we don't even know what the long-term impacts to our children are.
Mm-hmm. That's wonderful. I'm just stunned at how quickly you mobilized, you created this organization and really rallied around the long haulers, the long-term survivors, and people who are new to COVID and maybe just facing some of the symptoms that doctors haven't even caught on that are COVID related, that patients, when banded together, are a really powerful group of people. And so thank you really for doing this for everyone and for everyone involved in making this possible. So I guess tell me a little bit about how you started this nonprofit in such a short turnaround time. I'm so impressed, and we have lots of folks in the room. I think the theme for this year is pivoting, And I can't think of someone who's done more pivoting on these panels than you have. I mean, you went from being a professional photographer, formerly working in government, now to running your own organization, being a survivor, and really helping other survivors across the country understand their diagnosis, understand the long-term effects. And also, I think what you named is getting connected to care. I think the lack of care and capacity for testing, for tracing, for treating, that's all certainly growing, but it's certainly not where it needs to be now. I mean, my two much younger cousins, I'm in the same 1 out of 3 age group as you, but my much younger cousins went away to college, and literally within 2 weeks, 3 weeks, they're home with COVID, with their middle-aged, my aunts and uncles. And so there's no real place for them to go, no guidance on, like you said, the information is, when it is dire, then go to the emergency room. And that's definitely not a long-term solution that we're looking to continue.
You should definitely tell them that they need to donate plasma and tell all of their friends to the moment they are 21 days from the onset of symptoms, because it's the youngest people who are going to have the highest chances of getting through it okay. Mm-hmm. And the closer you are to infection, the more valuable that plasma is. So they can go out and truly change the world if they can gather their friends and all those people who have been newly infected, and who are not suffering, and who, weeks into it and are feeling well enough to go and give plasma. Please encourage them and get all of their friends to do it as well. In addition to our Facebook group, which is open to everybody, Survivor Corps, CORPS, we have a one-stop shop, a website, survivorcorps.com, which is, as I said, it's a one-stop shop on how to give back, how you can donate plasma, how you can sign up for every scientific, medical, and academic study and trial for which you qualify. But in terms of pivoting and starting this from scratch, I think it's one of those situations that, had I given it much thought, I would have sort of bowed out, being like, well, I have no idea how to do that. I've never taken a public health class. The last science class I took was in high school, practically.
Nonprofit. That's no small.
Right.
That's
yeah, no, I was a lawyer. I did work in politics. I worked for the government. I was a photographer. I had various skills that I was able to sort of cobble together, to put this thing together. But it was really, talk about building the airplane as we are flying it. I reached out to a handful of friends, and we've all been working together on it. I'm proud to say that of the really 7 of us who are on the team, 6, I believe, of us are Gen X moms, in our 40s and 50s. We are all dealing with our kids on the side. We had very disparate backgrounds, but and I was the only one of us who had COVID. But we have been in literal campaign mode since day one, and just sort of figured out each thing as it came along. So, I think had I realized how difficult it would be to set up as a 501c3, that would have been extremely daunting in the beginning. Sure. We were very lucky to actually, we got picked up by Morrison Forrester, has been doing our legal work pro bono from the beginning. Sachi and Sachi agreed to do our, a PR campaign for us pro bono. We've been very lucky to sort of have the kindness of strangers behind us. And we teamed up with a company called Multiplier, which is like a sort of shell organization for 501c3s, for newly formed 501c3s, because for us to have established legally around the country would have taken years.
Right.
Exactly. And well, with the pandemic, yet more, because so many of the offices are closed in terms of having to file the right papers and, be accepted in each state and so on. So it was easier for us to go work with a fiscal sponsor than do that on our own. And they are also able to provide the sort of back office support that we, just don't have the capacity to do. One of my favorite partnerships is our partnership with Boy Meets Girl, Stacy's company, who designed all of our sweatshirts and t-shirts and our masks. And I have to show off the drinking mask because it's like the coolest thing ever. Okay, you gotta
put on the OG mask, the one without the drink.
Put on the original one. I'll put on the drinking one. Okay, so looks like a normal mask, right? But gee, I'm thirsty. I sure would like some iced coffee. Ooh, look at that.
Uh-oh, I have to take off my mask to do that.
Amazing, right? So good for back to school, so good for the kids to be able to drink from their water bottles during the day, get their temperatures checked, whatever. Anyway.
I love that. It's less fiddling with it, less taking it off, putting it on,
And they're so comfortable. And I also just love working with Stacey's company because they have the same commitment to the same ideals as we do. And that's really important. We have been very lucky in that we have managed to partner with organizations really in every sphere of the COVID world, yet we continue to own ourselves. So we are able to make sure that the things that matter to us most, that we are able to hold dear to. So, had I thought through all of it at the beginning, I'm not sure how I would have even begun to start. It just sort of took off so quickly. And one of the things actually, so my strategy was really for a free media strategy, or earned media. That's where my background in politics was in earning media. And we certainly didn't have a penny to spend on media. I didn't have a penny to spend on anything. I had to dig into savings to buy the web domain. But, it worked. I think we've been featured in well over 1,000 media pieces. Wow. And to continue to be so, we just got Dr. Fauci to do a webinar with us on long haul COVID, which will be the first. He has acknowledged it, but it'll be the first time that he's ever spoken on the record in any length or any depth about it. So that's
have you spoken with him yet, or just kind of through?
I'm sorry?
Have you spoken with Dr. Fauci?
No, not yet. On October 2nd. So I'm very
invited, right? It's for the public to see.
Exactly. It's open to everybody. Just go to survivorcore.com, sign up for our newsletter. It's on October 2nd, and we'll send out information on how to log in and watch. It's free. It's open to everybody. You can submit a question so long as you're not a member of the media, and it will all be on the record. So that's an extraordinary opportunity. And then 2 days after that, I will be speaking on the National Mall in Washington, D.C. as part of the COVID National Remembrance Day, representing Survivor Corps and all of the people who are, basically on the record as having survived, but are really in truth far from it.
Sure. Oh my gosh. Well, thank you. This has been really eye-opening. And like I said, I'm just in awe of all the work you've done in the short time frame you've done it, while I think a lot of people, have felt really lost and scared. You really, I can tell you, were empowered by helping. And so thank you for doing what you do.
You're welcome. I say this a lot, but I really do believe that, as a nation, as a globe, we are being told that the best thing that we can do is do nothing. But that truly goes against the human spirit. It's not who we are as humanity. There's something hardwired in us to want to help. And so there's nothing more therapeutic. There's nothing more hopeful than being able to, whether it's donating plasma or signing up for a study, or just simply lending a kind word to another member on the Survivor Corps page, it makes us all, it puts us all in a better place.
I was just curious what you want to see happen with COVID-19, where you want to see people. This is really, Cause Marketing Summit is a tribe of development, marketing, PR, social impact folks who are really charged around moving the needle around missions they really care about. And so please let us know how we can better support you and what you're doing.
Thank you. Well, we need all the support that we can get. We need to amplify our message through the entire country. We need every last, I mean, we are trying to, when I say that we are trying to mobilize an army of survivors, we are trying to mobilize an army of all of the survivors, because every voice needs to be raised. You know, there's something really beautiful about Survivor Corps, and something that I think everyone would be proud to be a part of. We are living in one, I don't think you need to hear it from me to say, you need me to hear me say it, but I think it's obvious that we are living through one of the most fractured political and social times of our lives. And I'm proud to say that Survivor Corps is a corner of the internet, a not so small corner of the internet, where over 100,000 strangers are having the most civil, supportive, compassionate conversation anywhere in America. It's truly extraordinary, and that's why I call it the epicenter of hope. And so we have a lot of work ahead of us. We have policy changes that need to be made. We have demands on healthcare that need to be made. We need medical access. We need post-COVID care centers throughout the country. We need post-COVID care centers in areas that were traditionally medically underserved. Mm-hmm. We need to look at the communities that have been most heavily impacted. And at the end of the day, there are going to be very few communities throughout the country who are spared from the effects of this. You know, as we look ahead to the effects of long COVID, we are looking at what could potentially be the largest group of young disabled people in America ever. Wow. Even during wartime. Let that sink in. So we need policy changes. We need people to have medical access and disability insurance, regardless of whether or not they were able to get an original diagnostic test, because that was through no fault of their own that they were not distributed or they were faulty at the time. And so clinical diagnoses need to be a stand-in for a PCR test or antibody test. Not everybody comes out of this with antibodies. You know, there are so many issues that need to be tackled, and we need to start yesterday.
Mm-hmm. Is Survivor Corps something that organizations can tell their employees and their constituents about in the event that they're affected by COVID? Is this where you would point them to go?
Absolutely. Absolutely. Please, you know, the more that you can tell your membership, tell your people, if you have had COVID or if you know anyone who has had COVID, and at this point, just about everybody knows somebody who has had COVID, sure. This is the place to find refuge. This is a place to find answers. You know, normally you would say never ever go to the internet for medical advice. That's the worst idea possible. But the truth is that right now that's the only option most people have. And
everything is brand new.
And the truth is that we have a lot of clinicians in our group who are learning from members, from patients, because they realize that the patients know more than the doctors right now. And so this is not to blame the medical community at all. They have been drinking from a fire hose since last winter, but we are ready to work with them. Yeah. You know, we are ready to work hand in hand in lockstep. And our goal needs to be to raise science back to the center of our conversations. Right now, there's a tremendous lag between policies being made, guidance being given, so that we can make proper decisions, and the actual science that we've learned. We have learned a lot in the last 6 months, but our policies don't necessarily reflect it. We have known for months, for example, that the virus is aerosolized. That, you know, a good way to think about that is if someone, you know, if you're outside and someone around the corner from you lights up a cigarette, you smell it. You might not see it, but you smell it. In the same way, that's how the virus passes. Right. And So once you know that, why are we having mask breaks in school? Why are we having all the children eat in the cafeteria unmasked together? Our policies, we know that only 1/3 of people present with fever with COVID. Why are we relying on temperature check? That's using yesterday's solution to solve today's problem. So it might be very effective in screening for the flu, but really not particularly effective at all for COVID. And when it comes to children, most children present with GI issues.
Right.
So we need to stay on top of the science and make sure that every decision that we make policy-wise is based on the most up-to-date science that we have available to us. And so, send them to our Facebook group, but also send them to our website where we have, in this effort to create an educational feedback loop, we do a regular series of webinars. Dr. Fauci will certainly be our most, a famous one, but we have an incredible series that touches, we've done with the head of the Mayo Clinic on plasma. We have done one on explaining the role of T cells and how our long-term immunity has more to do with our T cell response than the presence of antibodies and what that means. Really going and doing deep dives on all of these issues. And also, and I cannot underscore this part enough, is making sure that we are tracking the mental health aspect of this whole piece. And that goes for people who have not had COVID, who have had COVID. There is not a one of us who is not suffering from the anxiety, the tremendous anxiety that has gone along with the last 6 months of our lives. And if it isn't impacting your mental health, then you're probably not really fully paying attention to what's going on.
Sure.
And so, we always want to keep that also at the forefront of our minds. So we have brought in a doctor who's double boarded in psychiatry and neurology to talk about how to cope with stress during COVID. And, talking a lot about immunity issues and if you have had COVID, should you be taking the flu shot? What are the chances of reinfection? What are when the vaccine comes out, is it something that someone who has already had COVID should take? These are the questions that need to be asked. And so we have just a tremendous trove of information there, from frequently asked questions explaining the difference between antibodies and antigens and all of these things that I've had to educate myself on in the last 6 months, but it's fascinating. And the more you learn, the more fascinating it is. And
more empowered you are to do something, to feel like you have some agency over what happens next.
Absolutely. And there are studies that you can sign up for if you haven't had COVID.
Wow.
There are ways to contribute to science. And I think that—
And also you're taking donations, I'm sure. You need funding. Yes,
we are taking donations. So yes, any donations are very, very, very welcome.
And looking for more corporate partners. I know that you've partnered with Boy Meets Girl, but that's something you're starting to explore more of, correct?
Yes, we would love to do more. And we are a small organization. We are doing the best we can, trying to just do so many things at once, which is incredible. And we have grant requests out to foundations, some of that have already been fulfilled, others that look likely to come in. We're keeping our fingers crossed, but we would love to be able to partner with other institutions, other organizations. We have scientists reaching out to us on a daily basis, wanting to partner with us. But our goal, again, is to be partnered with everybody, because I really see Survivor Corps as being almost the hub of the bicycle wheel when it comes to the COVID landscape. And we are apolitical, although we are demanding changes of the government. In fact, I have a call that starts in just a few minutes with the Government Accounting Office to talk about what the disability impacts are going to be and what kind of costs the government is going to have to anticipate with the issue of long haulers. So we need to amplify our voice as a coalition. And again, it's something that also for anyone who has an organization that touches on women in particular, it's really a lot of women who are, 75% it seems, of people suffering from long COVID. Long haulers are women. And something to think about that is that a lot of them are going to the doctor and they're being gaslit. They are being told that they have anxiety when they actually have tachycardia. And in a way, you can see that, you can look at it as being almost a modern day diagnosis of female hysteria.
Wow.
And we need to take these issues extremely seriously. And as women, we need to look out for other women and their health. And, when things come up that are syndrome-like, that doctors don't understand, it can put particularly women and minorities in precarious situations. And so we need to really do our best to advocate for
Empower
everybody.
them. Yeah, empower them with the information. And I worked for a coalition, kind of a similar model to what you've created, and empowering folks to understand that you can ask for a second opinion. You can go to another doctor.
Exactly.
It doesn't just stop there, and at least find someone who will listen to you and who will
take you seriously. 100%. And we have reports on our 98 symptom report is, you can download it from our website, and we have patients every single day who are downloading it and taking it to their doctors, literally highlighting every single symptom that they have, and said, so how you said that this didn't have anything to do with COVID? But the most incredible thing is that we're now seeing clinicians doing the same thing. So I saw an article came out of England a couple of days ago, a doctor who was presented with a patient who looked like he had peripheral neuropathy, had potentially had COVID, but had not been able to get a diagnostic test and didn't have antibodies. But from a clinical assessment, it seemed like it, but the doctor couldn't figure out what the connection could be between COVID and peripheral neuropathy. He did an internet search. He found Survivor Corps. He found our study that we had done with Indiana University School of Medicine. And he had an aha moment of realizing, yes, this is due to COVID, and was able to properly diagnose his patient. So that's what we're trying to do more of, to not work against the scientific and medical community, but work with them.
Absolutely. Oh my goodness. Well, thank you, Diana. I know you have a lot of really important work to do, and a very important call coming up. And so I'm just really thrilled to have you speak with us.
Thank you so much. Thank you so much. And you can, we've got awesome swag from Boy Meets Girl. You got to check it out. It's awesome.
Awesome. Well, thank you so much. And I'll make sure your link is on our website, and that everyone, if you'd like to share your contact information, I'm happy to do that as well.
Yeah, absolutely. You can reach out to us just at hq@survivorcorps.com, and it's CORPS.
Okay, perfect. Well, thank you. Have a
Thank
wonderful
you.
day.
Thank you so much.